So listen carefully. This class is very important class as usual. Fat-soluble vitamins. We already covered vitamin A, vitamin D. Now these are actually relatively small topics. Vitamin K and vitamin E. That is why I take them today. Okay. Vitamin E. Any idea? Bolo. Vitamin E. Any idea vitamin E? Let's start. Vitamin E also called as tocopherol, tocoianol. Tocotrienol. These are collective term as vitamin E. Among them, tocopherol. There are several tocopherol present in our nature. These are alpha tocopherol, beta tocopherol, gamma tocopherol, delta tocopherol. Among them, alpha tocopherol is biologically most active form, while gamma tocopherol is abundant in our food sources. Alpha tocopherol is working as reactive neutralizing reactive oxygen species, while gamma tocopherol neutralizes reactive nitrogen species. These are a question make asked in the Viva exam. Tell me what is the use of gamma tocopherol? You should answer. Gamma tocopherol is mostly neutralized as reactive nitrogen species, while alpha tocopherol is mostly work as neutralizing reactive oxygen species. What is reactive oxygen species? Any idea? In our body, each and every term, always metabolism is going on. So some byproducts are forming. They are actually very toxic to our body. Like free radicals. These are nothing but electrons releasing. Free electrons, they are actually damaging. So these electrons should be taken care of by our body by some defense mechanism. Among them, some enzymes they are superoxide dismutase, okay, SOD, glutathione, peroxide. Among them, vitamin E, vitamin A, some minerals like selenium. These are neutralizing our free radicals in our body. What is RNS? These are some free radicals which have nitrogen compound. These are called as reactive nitrogen species. So vitamin E, these are heat labile. They are fat soluble and it has a chromin ring is there. What is chromin ring? I am coming later. But this is most important antioxidant in our body. It acts as a free radical scavenger. So it is work as anti-aging, anti-sterility vitamin. Vitamin E also called as anti-sterility vitamin. Tocopherol, alpha tocopherol is most active form, as I told earlier. It contains 6 ways chromin ring with isopropanoate side chain. What is that? I am coming later. See, this is chromin ring. This is chromin ring. This one is chromin ring. These are all isopropanoate side chain. Okay. Tocotrienol. This has several double bond is there. It is not double bond. Okay. This is chromin ring. This part taken, the free electron moving, there is free radical moving, it can come here. And eventually they taken care of the free radicals. All of you know benzene ring, there are electron cloud is there, there is also electron cloud, they taken care of the free radicals. Okay. So biological function very important. Please take this screenshot or picture if you want. The main function of is chain breaking PUFA, polyunsaturated fatty acid, present in the cell membrane and when free radical damage this chain, it causes damage to the cell membrane. Say this is a cell membrane. This is a part of cell membrane. Here it has bilayer cell membrane. We have hydrophobic and hydrophilic layers there. Anyone tell me what is the hydrophobic? What is the hydrophilic? Hydrophilic means it can attack water. Hydrophobic means this repelled. Hydrophobic. And cell membrane is impermeable to water. Okay. This is because of hydrophobicity. Okay. So cell membrane we have PUFA, polyunsaturated fatty acid or fatty acid. Say this is a part of fatty acid. Here, if this one actually they hate water, they have hydrophilic nature. If one free radical damage here, it can cause cascade reaction. One free radical can generate more number of free radicals. These free radicals can attack one cell membrane. Eventually, one cascade reaction can start. This causes part of cell membrane can damage. By the way, this hydrophobicity nature will go away. Then the water can easily come inside cell and eventually causes cell destruction, cell burst out. Okay? বুঝতে পারনি? So this is a bilayer of cell membrane. It has nature of hydrophobicity. It cannot pass water inside the cell. This is because of presence of free fatty acid, polyunsaturated fatty acid. Free radical primarily attack to the side chain of fatty acid. Okay? If one part is damaged by a free radical, it can propagate more number of free radicals. One free radical can damage one part, this propagate chain reaction. Understand? By the way, if one reaction start, it eventually causes a big area of cell area can destroy. So, if the cell area destroyed, what happen? Water can go easily inside the cell. Eventually, cell will destroy. By this way, free radical destroy cell membrane. Free radical can start cascade reaction. Understand? যদি একটা ফ্রি রেডিক্যাল স্টার্ট শুরু করে একটা থেকে মাল্টিপল ফ্রি রেডিক্যাল তৈরি করতে পারে, এটা মনে রাখতে হবে। সো দিস কাইন্ড অফ কাসকেড চেইন শুড বি স্টপড। হাউ? ভিটামিন A sitting in the cell membrane itself. So here vitamin E is sitting here. If one free radical comes, it can take here. By this way, it neutralizes the free radical. Okay. Vitamin E present in cell membrane itself. Any doubt? সবাই বুঝতে পারলে? Okay. This process is termed as lipid peroxidation. Just remember this term. And lipid peroxidation is very dangerous in our body. If we start in the brain, it causes nerve damage. In the muscle, it causes muscle injury. Okay, and lipid peroxidation causes lot of diseases like degenerative disease in brain, in muscle myopathy, in eye retinopathy. Okay, in kidney nephropathy. So it should be stopped. So what happens in RBC cell membrane? RBC cell membrane can burst can destroy, causes hemolysis. Okay. In case of gonads, it prevents sterility by checking the free radical damage. So vitamin E, maintenance of germinal epithelium, it prevents sterility. In the blood vessel, the atherosclerosis can form. The LDL which go inside the endothelial space, subendothelial space, eventually it causes oxidation of LDL. You will read in next pathology classes in your second MBBS. Okay, so just listen to this. Oxidized LDL is actually the causative agent for atherosclerosis. What is atherosclerosis? This is formation of plaque inside the blood vessel. Okay. Vitamin E can prevent oxidation of LDL. By this way, it can prevent coronary artery diseases like myocardial infarction, stroke, peripheral vascular diseases, etc. Understand? With presence of selenium, it functions very well. Vitamin E also responsible for immune response. It participates in heme synthesis. These are some additional actions of vitamin E. In electron transport chain, it stabilizes ubiquinone. Have you heard the term ubiquinone? What is the function of that? Anyone? In the eye, it can prevent cataract formation by preventing oxidation of vitamin A. Proper storage of creatine phosphate in muscle, so it will also help in muscle function. So quick review. Biochemical function of vitamin E, main function is to prevent chain breaking of polyunsaturated fatty acid from free radical damage. Vitamin E accepts the free radical and it convert into quinone form. Okay. In RBC, it prevents hemolysis. It works as maintenance of germinal epithelium, so it prevents sterility. It prevents oxidation of LDL formation, which is related to coronary artery diseases. For antioxidant function, selenium is helpful. Okay. It is responsible for immune response. It participates heme synthesis. In electron transport chain, it stabilizes ubiquinone. It prevents oxidation of vitamin A, which causes prevention of cataract formation. And it works as proper storage of creatine phosphate stored in muscle. These are some additional functions of vitamin E. Understand? It is anti-aging, anti-cancer formation. Okay, very important vitamin E. Everyone can take vitamin E supplement every day. Okay. Next, recommended dairy allowances: men 10 mg and women 8 mg. Just remember this. RDA. Okay. The sources: nuts, almond, all vegetable oil like sunflower oil, safflower oil, peanut oil, soybean oil. These are very good sources of vitamin E. So vitamin E deficiency is very rare if you take vegetable oil regularly with our food. Understand? Deficiency, when the deficient condition occurs. As I told earlier, vitamin E is fat soluble. So any disease which causes fat malabsorption from gut, it eventually leads to vitamin E deficiency. Any disease which causes malabsorption of fat from our intestine, it eventually causes vitamin E deficiency. Like cystic fibrosis, one disease. This causes malfunction of exocrine pancreas, cystic fibrosis. So, fatty food not able to digest properly in cystic fibrosis. Next is celiac disease. What type of intestinal disease? Where intestinal mucosa can damage. Any sort of biliary insufficiency, like stone in common bile duct, obstructive jaundice, okay, biliary atresia, what causes biliary insufficiency. So bile is required for fat digestion. All of you know in physiology classes, bile occurs micellally. Okay, it helps in digestion. Another is A beta lipoproteinemia, a type of disease where chylomicron formation is defective. So there is no chylomicron, so there is no vitamin E transport. Not only vitamin E, but all other fat soluble vitamins are decreased because of the diseases. Vitamin A, D, E, K, all are absorption decreased because of this kind of diseases. Remember this. Okay. In deficiency vitamin E, as I told earlier, it causes some mild hemolytic anemia because of membrane damage of RBC. Okay. Neurological symptoms in vitamin E deficiency causes mild neurological symptoms like spinocerebellar ataxia, retinopathy, neuropathy, myopathy, etc. These are all because of lipid peroxidation. Question? Any question till now? Let's proceed. Toxicity. Actually, there is no toxicity vitamin E in adults. But in case of children, especially low birth weight children, if you give vitamin E supplement, it causes necrotizing enterocolitis. And remember, a patient taking warfarin or dicumarol drug, which is used for blood thinning after prosthesis in the heart or valvular replacement or bypass surgery, patient regularly prescribe this kind of drug, warfarin or dicumarol. Okay. So if you prescribe vitamin E supplement in this case of patient, it causes actually this increases potency of the drugs. The causes chances of hemorrhage is there. Okay. Remember this. This is the only contraindication of vitamin E supplement. I may ask you in the Viva exam. Name one condition where vitamin E supplement is prohibited. If we supplement vitamin E, this patient receiving warfarin or dicumarol, it causes bleeding tendency, increased bleeding tendency. Which patients? The patient taking warfarin or dicumarol. Okay. Next, vitamin K, very important. So quick review vitamin E. Vitamin E characteristic called as tocopherol or tocotrienol. Tocopherol very important. Here 4 types of tocopherol is there: alpha, beta, gamma, and delta tocopherol. Why alpha is more important, biologically active form, and GABA tocopherol is abundant in food sources. Common tocopherol. Okay. Alpha tocopherol is occurs nitrogen reactive oxygen species, while GABA tocopherol is nitrogen species. Okay. These are healthy bile, fat soluble. Most important, free radical scavenging. With the structure, commanding function are D8 10 mg, men, women 8 mg. Sources: nut, almond, vegetable oil, etc. The deficiency, toxicity. Next, vitamin K. Vitamin K derived from the name coagulation in German word meaning coagulation, blood clotting. Okay. There are three classes of vitamin K: K1, K2 and K3. K1, K2 are derivative of naphthalene with isophenolate side chain. K1 has 20 carbon side chain and K2 has 30 carbon side chain. K1 is also called as phylloquinone, which are actually plant sources, green leafy vegetables, and K2 called as menaquinone. These are animal sources. Also, in our intestine, there are some bacteria there. That is called gut flora. Gut flora bacteria can generate vitamin K2, menaquinone. Where K3, it is called as menadione. It is a synthetic form of vitamin K, and this is the only water soluble. Rest of two are fat soluble. So in a Viva, you can ask you, tell me the name of vitamin K which is water soluble. You have to answer this. Answer will be this: vitamin K3, menadione. This is a fat water soluble vitamin K. And remember, only fat soluble vitamin which is a work as a coenzyme. Write down this. Only fat soluble vitamin which work as a coenzyme. Vitamin K is work as a coenzyme. All of you know, all the water soluble vitamins are actually coenzyme. Thiamine, riboflavin, pyroxine, these are all coenzyme. Only fat soluble vitamin which work as a coenzyme is vitamin K. Remember. So vitamin K, also called as coagulation vitamin. There is three types of vitamin K: K1, K2 and K3. K1, K2 are actually fat soluble, where K3 is water soluble. K1 is also called as phylloquinone, which is actually 20 carbon chain, isophenolate side chain. These are only plant sources we found in green leafy vegetables. K2, it is found from animal sources. Also in our intestine, some bacteria is there. That is called gut flora. Gut flora can generate vitamin K2. So in adult, a healthy person, vitamin K2 deficiency very rare. Remember. And vitamin K3, it is also called as menadione. It is a synthetic form of vitamin K. It can be given in newborn children to prevent hemorrhagic diseases of newborn. Almost routinely given all newborn children. 0.5 to 1 mg intramuscularly given in all children after birth of the baby to prevent neonatal hemorrhagic diseases. And vitamin K is the only vitamin which work as a coenzyme. Next, biochemical function. Vitamin K's most important biochemical function is to post-translational gamma carboxylation of clotting factor 2, 7, 9 and 10. Post-translational gamma carboxylation of clotting factor 2, 7, 9 and 10. Remember, from liver there is clotting factor 2, 7, 9, 10. They are produced as inactive form. inactive zymogen form. They have to activate it. Activation occurs by vitamin K. Say example, this is a clotting factor. This is actually protein peptide chain. Here we have alpha carbon, beta carbon, gamma carbon. Okay. Here COOH. Say example, this is a chlorine factor 2. This is alpha carbon, beta carbon, gamma carbon. Here COOH is there, is attached. This is glutamic acid. Glutamate. This is glutamate. So you have to activate it by alpha, beta, gamma carbon, COOH, COO minus, COO minus, CH2, and form glutamic acid. So after gamma carboxylation done by say this is glutamate, this is glutamic acid. Okay, here it requires this enzyme, carboxylase enzyme. Who is talking? Who is talking? Don't talk. This carboxylase enzyme required carbon dioxide and oxygen, CO2, O2, and form this. Here you see there is 2 COO minus. It's come. So these both can interact with calcium ion. Okay. By this way, they form prothrombin, calcium ion, and attached with phospholipid of platelet membrane and form thrombin. Okay. By this way they get activated. Understand? This is called post-translational gamma carboxylation of factor 2, 7, 9, 10. Understand? So vitamin K itself, after this conversion, vitamin K itself get converted into oxidized form of vitamin K, that is called epoxide. This epoxide can convert into vitamin K quinone form by this enzyme, vitamin K epoxide reductase. Okay. This vitamin K epoxide reductase convert epoxide into vitamin K quinone form. Here warfarin can inhibit its function. Understand? Warfarin and dicumarol, as I told earlier, dicumarol, this prevent this enzyme. Again, put from vitamin K combined into reduced form of vitamin K by reductase enzyme, and it requires NADPH. Okay, so vitamin K cycle. This is vitamin K cycle. You have to remember this. ঠিক আছে? You have to go through the textbook. Okay. Next function is activation of osteocalcin. What is osteocalcin? This is actually another protein secreted by osteoblast from bone. It also required post-translational gamma carboxylation. Okay. So osteocalcin is required for bone formation, bone mineralization. So another very important of vitamin K is bone formation. Next function is activation of protein C and protein S. This protein also secreted from liver. Okay. And most important function of protein C and protein S, this work as anticoagulant function, apoptosis function, and work for inflammation as well. Protein C and protein S work as anticoagulant, work for apoptosis. What is apoptosis? Any idea? Very good. And for inflammation. I mentioned to forget, all the protein factors are produced by hepatocytes, and this is inactive zymogen form, and then they will activate it in endoplasmic reticulum. Okay. Next function of vitamin K is prevention of calcification of vasculature by activation of matrix protein. It prevents calcification in blood vessel endothelium. It prevents atherosclerosis. Another important function of vitamin K. So vitamin K also can prevent atherosclerosis disease. In case of patient taking just enough dose of vitamin K with their food, they eventually can develop osteoporosis. When there is excess vitamin K, this excess vitamin K can help in bone formation. So nowadays, as we are practicing doctor, we prescribe vitamin K supplement as well. Some commercially available calcium along with vitamin K is also there. You can prescribe to the patient. So calcium along with vitamin K is now available in my market. Especially post-menopausal women, they are prone to develop osteoporosis. So we can prescribe calcium along with vitamin K. So this is the mechanism. Osteocalcin, activation of osteocalcin, and ultimately bone formation. Okay, just listen to this. It will help you in the future also. And another function of vitamin K is it participates in neuronal metabolism. So adequate amount of vitamin K is required for proper coagulant function as well as anticoagulant function. Understand? Okay. Next, RDA 70 to 140 microgram per day. As I told earlier, vitamin K is formed inside our gut. So Deficiency very rare in adult people, normal people. Sources, as I told earlier, green leafy vegetable, there is vitamin K, 1. Animal food sources, there is K2, and vitamin K is synthesized from gut flora, microsomal flora. Deficiency manifestation, hemorrhagic disease in newborn and prolonged prothrombin time. Newborn, why there is a deficiency? We may ask you in the Viva exam. Why there is vitamin K deficiency in newborn children? Read this, sorry. Because of some reasons like less fat storage of vitamin K in newborn, because there is poor transplacental passage of vitamin K. And next one is the intestine of newborn is sterile. There is no microorganism or gut flora development in newborn. So there is no vitamin K generation in vitamin K in newborn. Sorry. And another thing is poor supply of vitamin K from breast milk. These are some causes. So, newborn are prone to develop hemorrhagic disease like hemorrhage, intracranial hemorrhage, hemorrhage from GI tract, umbilical cord bleeding. These are some dangerous conditions which can lead to death of the newborn. So, in order to prevent that, nowadays newborn are given intramuscular vitamin K injection after birth. 0.5 to 1 mg is given. The baby is very low weight, then given 0.5. Baby is normal birth weight, given 1 mg intramuscularly after birth. Okay. Next is deficiency in adult. As I told earlier, all the fat soluble vitamins can prone to develop a deficiency because of any condition, intestine diseases, which causes decreased absorption of fat from intestinal tract. It eventually causes vitamin K deficiency as well, like cystic fibrosis, intestinal disease, A beta lipoproteinemia, tropical spore like overgrowth of bacteria in the intestinal lumen, biliary obstruction. Another thing is broad spectrum antibody therapy. The patient taking broad spectrum antibiotic for prolonged time, then they eventually can develop vitamin K deficiency, especially in ICU patients. Okay. Nowadays, when we prescribe broad spectrum antibiotic, we often given probiotics, commercially available. Okay. Some patient can develop diarrhea after taking antibiotic therapy, so we can give probiotic. It will help to restore the intestinal flora. Understand? Some anti-conversion drugs can develop vitamin K deficiency. The phenytoin, like valproic acid, etc. Okay. Manifestation is increased bleeding time, increased prothrombin time. Okay. Understand, everyone? Next is toxicity. Toxicity is intravascular hemolysis, jaundice. Whatever jaundice, can you expect? No, toxicity. Is it whatever jaundice? Conjugated or unconjugated? Hyperbilirubinemia? Unconjugated because of hemolysis. Remember. Okay. And carnivorous is a type of jaundice where it can affect the brain, especially babies can affect. Where bilirubin level is very high, it can eventually causes blood-brain barrier, can destroy the brain. Carnivorous. So this kind of toxicity develop. Lab test, how can we assess vitamin A deficiency? We first see the prothom bean time. If prothom time is high, I can inject vitamin K, and then again we test prothom bean time. The time is corrected after vitamin K administration, then patient is develop vitamin K deficiency. Suffering from vitamin K deficiency. Understand? First of all, we measure the prothom bean time. It is come high, and we gain vitamin K injection, and then again we test prothom bean time. Second time it come normal, then we can say the patient is suffering from vitamin K deficiency. Understand? Very easy. Otherwise, it will be because of liver disease. First PT is high, we given vitamin K injection. Again PT is high, there is patient is suffering from liver disease, not vitamin K deficiency. By this way, you can understand the patient can develop suffering from vitamin K deficiency or not. Understand? Okay. So thank you.